So please, everybody, you can share the link. You can share the Facebook page, so everybody can يستفيد من هاي المحاضرة إن شاء الله. اليوم التوبيك حيكون How to diagnose Gummy smile step by step. في محاضرات ثانية إن شاء الله جاي على الطريق اللي هي How to do crown lengthening, How to diagnose crown lengthening, also step by step. اليوم المحاضرة بتوقع تكون بحدود من 45 ل 60 دقيقة. It's almost 45 up to 60 minutes. زي ما حكيت هتكلم باللغة العربية، وإذا لاحظت إنه في بعض الزملاء مش فاهم علي ممكن أشرح له باللغة الإنجليزية. أوكي. إحنا إن شاء الله بالأيام القادمة حنحاول جهدنا إن نحارب جميعا هذا المرض. إحنا كليتنا لنا دور، ممكن يكون دورك بسيط وهو إنك بس to stay at home، وممكن يكون لك دور ثاني إنك تساعد other medical staff. I believe that everybody inshallah will يتفق مع بعض, will stay together and we will defeat this disease. Yesterday just we had an instructions from the authorities to stop all non-urgent procedures. وبتمنى من الجميع إنه يحاول يلتزم بالتعليمات قدر الإمكان. It's a tough time I know. ولازم نتحد كليتنا عشان نقلل المدة اللي هذا المرض حيضل موجود ويؤذي الجميع. It's time also to stay with family. ويمكن هاي فترة من الفترات اللي قليلة أنا اللي بكون موجود فيها في بالبيت مع الأولاد، وبحاول قدر الإمكان أقضي معهم الآن أطول وقت ممكن. ومن الأشياء اللي أنا بدأتها حالياً في البيت مع الأولاد اللي هي البازل. Actually, my wife she brings the puzzle, and I every while and then I'm just trying to. It's not easy, okay. And we choose to something that is more homey. So we choose how to a puzzle of home or house, and we reached to this level. I believe most of you maybe started that one, and it's really. So who we are Dental Art Academy Group. We do a lot of courses in all branches of dentistry since 2013. احنا بنسوي كورسات من سنه 2013 في البحرين، في دول الخليج تقريبا عندنا محاضرين معروفين من كل دول الخليج، ومن الاردن، من لبنان، من مصر، من دول اوروبا، من UK. معظم المواضيع تقريبا سوينا خلال 5 أو 7 سنوات الماضيه. معظم الزملاء حضروا عندنا على البحرين او في دول الخليج وحضروا معنا هاي الكورسات، واحنا فخورين كثير فيكم. وبهالوقت كمان احنا حنكون معاكم لبين ما تنتهي هاي المحنه. حنكون موجودين معاكم، ما حنتوقف ان شاء الله. هاي بدايه لمحاضرات، وان شاء الله ان ما حنوقف التعليم. ليش احنا موجودين هون اليوم؟ وانا دائما هذا التوبيك بالكورسات اللي بنعملها بحاول شوي اركز عليه. بعياداتنا احنا بشكل عام بيجونا المرضى عندهم concerns او worries، بيكونوا sometime عندهم تخوفات معينه من او مشاكل معينه انه how they look during smiling. ومعظمهم بيجي بيسال على انه بدي اجمل اسناني، او دكتور بدي اضبط الابتسامه. لكن في معظم الاوقات بيكون المشكله مش مشكله اسنان، المشكله بتكون مشكله لثه. في معظم الاوقات قله من المرضى، ويمكن شوي ابتدت تزيد، اللي بيكون عندهم وعي عن موضوع الابتسامه اللثويه. عشان هيك لما تشوفوا هاي الصور الثلاثه او هاي 3 حالات، كل واحده فيهم لها سبب مختلف عن الثانيه ليش هي فعلا عندها جامي سمايل. واليوم وظيفتي بهذا الكورس او هاي المحاضره القصيره اني احاول قدر الامكان ازيد الوعي عند اطباء الاسنان عن كيف تشخص الابتسامه اللثويه، واذا فعلا انت محتاج انك تحول هاي الحالات، انت كطبيب اسنان شو حيكون دورك فيها. وبالمناسبه احنا يعني في عيادات طب الاسنان بتجينا كثير حالات، سواء كنت انت جنرال دنتست او سبيشالست. حتى لما بدنا نعمل ريفيرال لتر سواء كان للماكسيلوفيشال سيرجن او للاورثودونتست، we don't know the definite diagnosis of the gummy smile itself. So في هاي المحاضرة أنا حركز mainly how to diagnose gummy smile step by step, how to differentiate between different causes of gummy smile. وإحنا دورنا إيش بالضبط بهذا الموضوع كدنتست, general dentist, maybe specialist before we refer this case to the orthodontist او لما maxillofacial surgeon او maybe plastic surgeon. So يا جماعه usually يعني حتى لما بنتناقش احنا والزملاء مرات انه في ليفل اوف كونفيوجن كثير عالي في هذا التوبيك. يعني بيجوك مره بيقولوا انا عندي جامي سمايل و ليترالي لما تحكي طب شو سببها؟ شخصت الموضوع او تفرجت شو كان عنده كيس، بقول لك انا شفت انه كميه اللثه كثير مبينه او الحجم اللي انا بشوفه باللثه كثير كبير. So sorry, I have some participant they want in English. It's okay. So I would like to mix between Arabic and English. So the level of confusion is really high, and most of the our colleagues really, when I ask them where are you here, most of them they are either from 7, maybe sometimes 4, sometimes 3. Very few who really know how to diagnose gummy smile properly and refer the case. And I wish that during this course that none of you will feel sleepy and will enjoy what I'm really trying to explain today. Before we start this topic, لازم شوي نركز على in case to diagnose any unhealthy or pathology, we need really first to know what is the state of health, which means in order to diagnose a gummy smile, you need to know before what are the characteristics of gummy smile or normal smile, let's say, and then start saying, okay, this is the cause and these are the differential diagnosis for this case, or maybe there are combined factors for gummy smile. So usually when we do smile analysis for our patients, we need to refer to a point. يعني لازم يكون في عندنا point to go back again and compare this case to the normal or natural situation. And according to Da Vinci, just 100 years before, he said that the body is in proportion. And what does that mean? It means that in your body, the distances between, let's say, your elbow and your hand is exactly the same as your chest. The idea is that body is in proportion. And this is the normal or perfect body. And usually even when you look at the smile of the patient or facial dimensions, we even sometimes have some proportions, okay, to measure, and these proportions should be also equal to each other. But do we really, or do our patients really aim for perfection? هل مرضانا بيدوروا على البرفكشن؟ وهل احنا بعلاجاتنا نسعى الى البرفكشن؟ والجواب هو انه حتى دافنشي نفسه لما رسم الموناليزا كان في ميثس كثيره انه الموناليزا لما هي رسمت كان the face is in the middle of the drawing itself, her eye exactly is in the middle. All of this is a myth, and usually our patient when they came to our clinic, usually they don't sit exactly what you are seeing right now in the picture. بمعنى انه انت لما تطلب من مريضك انه يبتسم او يجلس هو فعليا ما حيجلس. Right now, even young generation, they tend to have a different type of Mona Lisa smile, in which we all know is the snap smile. And this is really what our patients is trying to do during normal life, okay? So do we really aim for perfection or not? Sometimes, I think most of the cases, we try to aim for perfection, but our patients do not know these perfection points, okay? And we are really nowadays, even in my clinic, I'm trying to meet my patient expectation as much as I can. So after I finish, I wish that she will reach to a point that she will make this move and express her feelings about my work. But at the end, again, do our patients aim for perfection? My answer is, most of the time, patients think they are aiming for perfection, but from a dentist point of view, this is not perfection. To analyze, okay, let me just sanitize my face so that no one will tell me why you are touching your face. Okay, so in order to diagnose the case, you need to know the aesthetic element of any smile. Okay. usually patients, as I told you, when they came to your clinic, you will ask them to smile, okay? And when you ask them to take a photo, you will just say cheese or any word just to let them smile. This kind of smile, we call it paused smile, okay? What is paused smile or social smile? Social smile is when you ask your patient to take a photo, okay? He will just give you the normal smile. What is the characteristic of this paused or social smile? This smile is reproducible, which means that the patient can do it 100 times the same. The other kind of smile in which you will try your best to see it in your patient is when the patient laugh or he just hear the joke, or you are trying to make jokes with him and let him give you the unpaused or emotional smile. This emotional smile is the one that you aim for. And why is that? Because usually patients can reproduce their social smile and they can control it. Patients, when you ask them to take a photo, they can give you exactly every time the same smile, and they will try their best to give you the smile that is not showing the gummy smile. While if you ask your patient to laugh or you tell a joke, he will give you the unpaused or emotional smile in which he will try to put his hand on face. Nowadays, nobody can put his hand on the face, so he will try to hide it. And this is what we aim for to correct. But in reality, we will try our best to correct, because the emotional smile is the hardest smile to correct. Okay, so there are two types of smile. As we said, we have a paused smile, we have the the emotional smile. And when we diagnose the gummy smile, usually we, even in literature, okay, since even 1978, the diagnosis of gummy smile came from the paused smile, okay? Whoever before tried to make a diagnosis for a gummy smile, and even the classification of gummy smile only came from the paused smile. So we'll just ask the patient to smile and then try to measure. And since and everybody knows that the amount of gingiva that is showing during gummy smile will be measured, and then we will classify the smile. Now in 1984, John just give us 3 classification, and everybody knows it, on how much the amount of central incisor exposed, in which we will have, in case we have 75% of the central incisor showed, this means that we have a low smile line. In case we have higher than this, up to 100, this is an average smile line. Most of the people is in the average smile line. While if you have part of the gingiva more than 2 millimeters shown or above, they classify it as high smile line. Again, this is only on paused smile. Paused smile means that when you ask your patient to smile, and he will keep giving you the same result every time you ask him to smile. Okay? The emotional smile was not used to diagnose what we are talking about today, the emotional smile. So the emotional smile was not used. What was used was the paused smile. So most of the dentists, even when you tell him how much gummy smile he has, he will tell you 2 to 4 millimeter or above 4 millimeter or even low, but he is depending on the paused smile. So when you tell any patient to smile, he will just give you a smile that is unopposed or social smile that you can measure on it. And why is that? Because in emotional smile, you cannot catch the patient, because usually the emotional smile is few seconds, even sometimes part of the second. You cannot catch it with the camera or catch it with the measure. While with the paused smile, you can really measure it. So again, will depend on the classical classification of gummy smile. But what I'm going to talk now, and I'm asking you to do now, is the emotional smile, and I will discuss it later. Okay. So excessive amount of gingiva shown more than, let's say, 2 to 4 millimeter will be classified unattractive. And everybody agrees that this is my patient here. When she came to me, she gave me a paused smile, and this was even much higher than 4 millimeter. This is a paused smile more than 4 millimeter. Another point you need to know when you diagnose the gummy smile is that, is this gummy smile symmetrical or not? I mean that you might have a gummy smile in which your left side is not the same as the left side. And this has many reasons. The most important reason for that, we call it canting. Everybody know that the maxilla in the normal, or let's say natural smile or normal patient, the maxilla is perpendicular to the interpupillary line. This is the normal situation. In some patients, we will have like canting mayalan al-maxilla canted into one side. So when he give you the gummy smile, it will be higher in one side than the other side. This is one cause. I will be talking also another causes during the lecture, but I want you to know that the symmetry of the smile also one of the points that you need to check while you are diagnosing the gummy smile. لحد الآن أنا قاعد أتكلم بس عن بعض النقاط قبل ما أدخل في الموضوع. I'm just discussing the few points before we start doing the differential diagnosis of gummy smile. Okay. As we said, the symmetry of the face is also needed, and the point of the gingival margin also. Everybody knows that the point connecting the canine and the central incisors is almost the same height, while the lateral incisor is 1 millimeter lower than this line. Okay, so if you find one patient having gummy smile in one side more than the other, put in your mind that this could be either the gingival line is not symmetry, or the maxilla itself it's a little bit canted. Okay, again, I'm just discussing a few points before going deep into the topic. Okay, what else? As we said, this was the natural smile. What about the gummy smile? We need to know exactly what happened. Why the patient, when he was giving you a paused smile or rest position, and then once you ask him to give you sometimes paused smile or even emotional smile, he is giving you a gummy smile. إحنا ليش بيحصل معانا هيك؟ إيش اللي حصل بالضبط بين الريست بوزيشن أو الريست بوزيشن أو البوزد سمايل الخفيفة وبين الإيموشنال سمايل؟ شو العوامل اللي تدخلت عشان صار عندنا gummy smile؟ So we will be discussing 5 factors. Now this lecture is all about these 5 factors, okay? And again, this lecture is not about discussing the surgical procedure itself. I'm gonna inshallah do maybe 1 or 2 lectures later about the procedure itself. But before going deep into this procedure, I would like to just let you know how to classify the gummy smile. We will be talking about 5 reasons, main 5 reasons for gummy smile, and it's mentioned in this slide. I will discuss every term one by one and try to explain it, and then I will make a differential diagnosis. So أنا حأسمي الأسماء ال5 هاي واحد وحعرفها إيش هي، وبعدين بنهاية المحاضرة حنبتدي نعمل مع بعض شيء اسمه differential diagnosis. So I have a question on how can we treat low smile line. Low smile line sometimes is either related to lazy muscles, sometimes is related to let's say short incisors. Okay, so we will discuss it later when we go on through the topic. Okay, so first point is the vertical maxillary axis. Again, I'm talking about the 5 main reasons for the gummy smile. The first reason is vertical maxillary axis. What is vertical maxillary axis? Usually in any patient, if you take a cephalometry for him, okay, there are, as we already discussed, there are facial heights, okay? The mid portion and the lower portion here. If you take a cephalometry, as you can see here in the slide, this middle portion and lower portion should be, in most of the patient or normal patient, should be equal. What happened in this patient is that when they have increased this distance more than this distance in the X-ray, you will see it later. When you see this distance is more, the lower facial height is higher in amount than the middle facial height, you will see that most of these patients, we classify them as vertical maxillary axis. بيحصل عن إنه long lower third of the face, and most of these patients will find it hard to make the lip competent. يعني مش بسهولة بيقدر يخلي شفايفه competent إنهم يتلامسوا مع بعض بدون ما يحط force. So lip incompetence is one of the major characteristics of this kind of patients. Okay, again, still this is cause number 1 of gummy smile. I'm just explaining the terms right now. So زي ما حكينا معظم هدول المرضى, most of these patients will have incompetent lips even when in rest lip position. لما تسأله إنه يعمل wetting للlip and you ask him to rest, he will give you this amount of teeth shown, and then once you ask him to smile, he will exactly give you this one. And if you take a cephalometry for him, you will find that the lower facial height is much higher than the middle facial. Okay. The second main reason of gummy smile, حكينا على الvertical maxillary axis. الآن هنتكلم على شيء اسمه short upper lip. من الأسباب الجامي smile, one of the main reasons of gummy smile, and I think from my point of view, this is the hardest cause. I mean, this is maybe one of the reasons for gummy smile that you really can't treat sometimes, and you should really refer to a plastic surgeon in case the patient insists on treating her case. شو الشورت upper lip? How we diagnose the short upper lip? Usually distance lip measurement, we take it from the middle بشيء اسمه الفلترم, and we take it also from the sides of the lip, we call it commissures. المسافة اللي من الفلترم اللي هي من التip of the nose or lower base of the nose to the lip, we call it filtrum. It will be short in those patients. والمسافة اللي من side of the nose to the commissure will be really long. In these patients, they have something called a V-shaped upper lip or short upper lip. In normal patients, in males, the distance is this distance is almost like 22-24 millimeter, while in or let's say the average length of upper lip is about 22 to 24 millimeter, while in females is a little bit less. Most of these patients, as you can see in this photo, that the filtrum height here, okay, is is really shorter than this distance, and it creates the V-shaped look of the upper lip. Okay. خلصنا second cause. We already finished two causes of the gummy smile. A third main cause of the gummy smile is the well-known hypermobility of upper lip. We all know that the upper lip is controlled by many muscles that controls really the pull of the upper lip. Okay, and in case that you have these elevator muscles having hypermobility, you will have the gummy smile. And in normal patient, usually the elevation is almost 7 to 8 millimeter here. While in patients that having a hypermobility of upper lip or hyperfunction of the upper lip, you will see that the distance that is the lip is able to move is even higher, 9, 10, and even higher. So one of the third cause that we are going to discuss also is the hypermobility of the upper lip. So we discussed vertical maxillary axis, okay, as we said, the middle third and the lower third. We discussed short lip, and the third one right now is the hypermobility of the upper lip. Fourth cause, which is the number 4, is what we called altered delayed passive eruption. Okay, what is altered delayed passive eruption? بالأطفال usually during eruption في نوعين من eruption. في نوع اسمه active eruption in which the teeth is erupting, okay, coming down, and up to a point بيوقف هذا active eruption وبيبتدي شيء اسمه passive eruption. Passive eruption in which the gum is going to up, يعني بتصير اللثة تطلع up, and then more teeth is exposed, okay, and then we are telling our kids, oh, your teeth is becoming longer or your teeth is erupting now. الحقيقة إنه لا، اللثة اللي قاعدة تصعد لفوق. ففي شيء اسمه active eruption in which the tooth is coming down up to a level, okay, for the meeting the lower teeth, and then the gum is going up, in which we call the passive eruption. Passive eruption, the gum is going up so we'll have more eruption, but it's called passive eruption. So what happened on those kind of patient? Those kind of patient, the passive eruption didn't happen. So it's called altered passive eruption, in which the passive eruption is not happening. So we'll have part of the gum is covering the tooth, okay? And here I should pinpoint how to diagnose this one. Usually, you cannot say that this tooth has had an altered passive eruption until you know what are the dimensions of this tooth. So usually in the front area, if you should have a golden proportion width over the length, and everybody knows that. يعني انت عشان تشخص انه هاي الحاله عنده ultra passive eruption لازم الاصل اصلا تعرف شو طول هذا السن او شو ابعاد هذا السن. فانت usually اذا قسمت if you divide the width over the length you will reach to a point that النسبه هاي من 75 ل 85% كلياتنا بنعرفها. فاذا النسبه هاي اقل من ذلك معناها انت اللي صاير معك انه السن متغطي باللثه، يعني الطول شويه صاير او كميه اللثه مغطيه السن فطول السن صاير قليل. فاذا احنا بدنا نشخص الموضوع انه التر باسيف ايربشن يعني اللثه صاعده فوق السن، لازم نكون اصلا عارفين الدايمنشنز الصحيحه للاسنان. هلا في بعض الناس مثلا ليتس سي بالسنترال انسايزر العرض بيكون تقريبا من 8 ونص 7 ونص والطول بيكون 11، فاذا قسمنا 7 ونص على 11 بتطلع النسبه بين 75 ل 85%. كذلك بالنسبه لللاترالز والسنترالز. هذا كثير مهم، ويمكن بنهايه هذه المحاضره يعني حتتفاجئوا انه السبب الوحيد للجامي سمايل اللي احنا كاطباء اسنان as either general dentist or a periodontist or even other specialty can do in their clinic is the causes in which the patient has ultra passive eruption. الكيسز اللي بيكون فيها الفيرتيكال maxillary excess او الهايبر موبيليتي of upper lip or short lip will be even maybe referred to other specialties, while the main cause or the only cause that we can treat in our clinics is this cause. Okay, so when we have altered passive eruption, means that part of the gum is covering the tooth. Why is that? Because during eruption, the tooth goes into active eruption up to a point, and then the gum is not going up, and the passive eruption is not or is delayed or altered. Okay. So again, the active eruption is movement of the teeth in occlusal direction, while the passive eruption is exposure of the teeth by apical migration of the teeth. Okay. Someone is asking also how we'll treat. We go to that. We just now explaining the terminology and also causes, and then we'll go step by step by differential diagnosis and what is the treatment of each. Okay. So I'm just even discussing this part again and again, is that usually maxillary central incisors and canines keep on to erupting, okay, up to a level up to almost 12 years old, and then passive eruption starts. And in patient in which we don't have passive eruption, we will have gummy smile on those patients. That's why patients, young patients, sometimes if you notice that he's not continuing his passive eruption, maybe we should refer right now, or we should, as a parents or as a periodontist or as a general dentist, we start maybe asking consultation for an orthodontist what to do right now, maybe, or maybe another cause is causing the gummy smile. But if you notice that the child at 12 years old and on he's having gummy smile, his full teeth is not shown, maybe another cause is there for gummy smile, and I will discuss it. But I mean that referring the patient at early stage is a most important factor in these patients. Okay, let's move. So in patients that don't have passive eruption, they will have altered passive eruption, and then they will end up by having gummy smile. Okay. The number 5 cause is detort or lingual tip maxillary incisors. Some patients, they have gummy smile, and if you have a close look on this gummy smile, you will notice that the reason for this gummy smile is that these 2 incisors are a little bit lingually torqued or lingually tipped. And how can we differentiate this one? If you have a side look on the or profile or lateral photo of the teeth, you will see that most of the teeth have an occlusal plane. And then once you reach to the central incisor, you will feel that the central incisor is even lower than this plane. يعني أنت في هذا الخط, if you see the mouse, إذا بهذا الخط occlusal plane is going here. Once we reach to the central incisors, it's going down and a little bit tipped back. And most of these patients, they have this problem since maybe 10 or 12 years old. That's what I'm talking that. That's what I'm explaining to you, that most of these patients has to be referred to the orthodontist maybe at early stage, and I will discuss that one later. So the the number 5 reason is the lingually tipped maxillary incisors. Now, other miscellaneous, or let's say other factors that may be contributing to the gummy smile, we said that vertical maxillary excess, short upper lip, hypermobility of upper lip, or we have ultrapassive eruption, and we have the lingually torqued maxillary central incisors. Patients on medication, we know that kind of medication that they will have overgrowth of their gingiva, also is a cause of gummy smile. Patients who completed orthodontic treatment shouldn't be considered for a gummy smile until we wait like maybe a couple of weeks until the gum relaxed back after we debond the orthodontic braces. So do not rush into these patients until they either change their medication, if in case they are taking medication, or they finish their orthodontic treatment. في معظم المرضى اللي بنخلص التقويم ننصح المريض انه يستنى اسبوع لاسبوعين عشان ناخذ الفاينل بوزيشن، انه بيكون حاصل اوفر جروث بعد التقويم. وفي المرضى اللي بيكونوا بياخذوا ميديكيشن we'll tell them that the medication is the cause, and we will ask consultation from their doctor on either to change the medicine itself, or to wait, or to help them a little bit with cutting the excess gingiva without considering this case a gummy smile. يعني احنا ما بنعامل هاي الكيس as a gummy smile, we just consider it as overgrowth. Okay. So after we know these, after we know these 5 causes, now we will start the differential diagnosis. And now, please, everybody, try to focus with me, because it's really a little bit confusing. But if you get the idea, you will really get after this lecture to diagnose maybe most of the cases, and we will be able to differentially diagnose the cause of the gummy smile and how to refer this case. Okay. Okay. So first, إذا أنت حابب تعرف أي واحد من هذول ال5 كان الكوز of your gummy smile, you need to go back again before asking the patient to smile. You need to ask him to do the resting lip position. Okay. Usually, when you ask your patient to wet his upper lip and relax, part of the incisor, as you can see here in the photo, part of the incisors are shown. Okay, so rest position. I'm not talking about posed smile. I'm not talking about emotional smile. I'm just asking my patient to do a resting lip position. In normal patients, resting lip position should show about 3 to 4 millimeter of the maxillary anterior incisors. Okay. Now, some patients, due to age, due to attrition, female, male, have different, or let's say lower amount of incisors showing. But usually, in the normal patients, this is the amount that has to be shown, 3 to 4 millimeter in rest lip position. So أول خطوة هطلب من مريضي إنه يعمل rest lip position. أوكي، اتفقنا؟ طيب. 3 to 4 millimeter rest lip position. And as we said already, that age and with age, some patients have attrition, and this amount is decreased. And also, 6 is affecting this one. I mean, the either male or female. So, if we asked, now we have 5 reasons. Remember, okay, 5 reasons. Now, if we have patient that we asked him to do rest lip position, and he show us only 3 to 4 millimeter, and then we ask him to smile emotionally. Now, this is a different way to classify gummy smile. As I told you before, most of the methods that was used to ask the patient to do a posed smile. And we classify them either low smile line, or average smile line, or high smile line. Now, I'm asking you to start from before smile to do rest lip position for your patient, and then ask them to do the emotional smile, not the posed smile. يعني اطلب من مريضك يعمل rest lip position, and immediately حاول انك تضحكه او تشوف هو لو طلبت منه يضحك بقوه، او انه تكون مش posed smile، يكون اقوى ابتسامه عنده، شو بيعطيك. هلا اذا كان انت بدات if you started with a normal lip position rest lip position، وكان عندك الامount of anterior showed هو 3 to 4 millimeter, then and you ask him to do an emotional smile, at that time, if the pure patient has gummy smile, Okay, then the cause will be either hypermobility of upper lip or a short clinical crown in which we called altered passive eruption. يعني إذا إحنا ضربنا من مريضنا على الريست ليب بوزيشن وشفناها 3 to 4 ملم مش أكثر وعملنا له emotional smile. Okay, how to ask for wrist lip position? Just try to wet the patient, ask him to wet his lip with his tongue and relax, and you can see how much exactly the amount of central incisor is showing. If you would like to ask me question, I can ask question on Facebook page, Dent Art Academy, and whatever I'm seeing questions, I'm trying to answer. So let's go back. If you have 3 to 4 millimeter, and then you ask your patient to do the emotional smile, there are two main reasons, okay? Either hypermobility of upper lip or short clinical crown. Which one we should start with? We should start with measuring the clinical crown. How much clinical crown we can see. We will do our measurement اللي حكينا عليها proportion width over the length. If it is normal or it is not. Okay? So first point, we will check the proportions. If the proportions is altered, then it is either يعني هي أقل من 75%، إذا هي altered passive eruption، أو ممكن يكون عم بياخذ medication زي ما حكينا، أو after ortho treatment. أوكي؟ وممكن بعض الناس يكون صار عندهم already let's say attrition، وبهالحالة إذا صار عنده attrition بيكون في عنده let's say اللثة بتحاول تنزل شوية عشان تعوض. معظم المرضى اللي عندهم attrition of anterior teeth the upper gum is trying to overgrow to compensate for that. But again, we will measure the clinical proportion of the anterior teeth. إذا كان altered هاي proportion كانت قليلة، لما أنت قست الويدث over the length كانت قليلة، معناته أبعاد السن مش مضبوطة، فعلى الأغلب الكوز هو short clinical crown. أوكي؟ إذا كان لما قست الابعاد الويدث اوفر ذا لينث مش متغيره مضبوطه 75 ل 85%، اذا احنا بنتكلم على الهايبر موبيليتي اوف ابر ليب. كمان مره، لانه هاي هي السلايدات المهمه في المحاضره. احنا عندنا 5 اسباب. طلبنا من المريض يعمل ريست ليب بوزيشن كانت 3 to 4 ملم على الريست ليب بوزيشن. بعدين طلبنا منه يعمل ايموشنال سمايل مش بوزد سمايل، وبهاي اللحظة وجدنا إنه عنده جامي سمايل. بهاي اللحظة إحنا عندنا سببين من الخمسة اللي هم either altered passive eruption أو hypermobility of upper lip زي ما هو مكتوب بالسلايد. أي واحد فيهم نبدأ بالaltered passive eruption. بنقيس عرض السن على طول السن. إذا كان العرض على الطول متغير اقل من الطبيعي، معناته في عندنا خطا في ابعاد السن، معناته اللثه صار فيها اوفر جروث. هذا هو السبب الرئيسي. اذا ما متغير على الاغلب السبب هو هايبر موبيليتي اوف ابر ليب. اوكي؟ سو زي ما حكينا الهايبر موبيليتي اوف ابر ليب نسبتها بشكل عام مش عاليه. اتس مور انتو فيميلز راذر انتو ميلز. لكن لما احنا بنطلب من المريض يعمل ريست ليب بوزيشن ويكون نورمال ريست ليب بوزيشن اللي هو 3 to 4 ملم incisor is showing، بعدين نطلب منه ايموشنال سمايل بيعطيني كم سمايل زي ما حكينا either altered passive eruption or hypermobility of upper lip. بنبدا ان نفحص او نقيس العرض على الطول عشان نعرف ال proportion of teeth. If it is changed then this is the main cause. If it is not changed maybe the hypermobility of upper lip is the cause right now. فاحنا خلصنا من 5 خلصنا 2. الان من ال5 راحوا 2 باقي 3. كيف بشخص ال3 الباقيين؟ اذا انا طلبت من مريضي يعمل ريست ليب بوزيشن again by wetting the upper lip، اوكي، وطلبت منه يرتاح and then I measure the amount of central incisor showing. اذا طلبت منه يعمل هاي الحركه وكان الاماونت اكثر من 3 ل 4، في اول السلايدات اللي قبليها قبل شوي كان الاماونت 3 ل 4 نورمال. الان انا قاعد اقيس هذا الشيء وقاعد يبين معايا اكثر من 3 ل 4 ملم. هذا الستارت بوينت and then I ask him do for me emotional smile and then he give me a gummy smile. The other 3 causes are there اللي هي either short upper lip, over eruption of maxillary incisors وlingually tipped اللي حكينا عليه، او vertical maxillary excess. فهي 3 اسباب. كيف حنبدا؟ اي واحد فيهم نبدا فيه. قبل شويه كان في عندنا سببين، بدينا بالالتر باسيف ايربشن. طيب من هاي 3 اسباب اللي انتم شايفينها بالسلايد اي واحد فيهم حبدا فيه؟ على الاغلب حبدا بالفيرتيكال ماكسيلري اكسس. اول خطوه، اول نقطه بفحصها في المريض بهذول المرضى لما انا اطلب منه يعمل ريست ليب بوزيشن ورجاني اكثر من 3 to 4 ملم، more than 3 to 4 ملم at rest is showing, and then I ask him to do a gummy, an emotional smile واعطاني gummy smile, then there are 3 reasons. The first one that I should inspect is the vertical maxillary axis. Okay, and then you need to take now what cephalometry X-ray. In the cephalometry, if you take for your patient a cephalometry, and most of the patients they will even show the incompetent lip اللي حكينا عنه. His lip or her lip cannot be coming to each other without a force or without an effort. So if you take a cephalometry for these patients, you will see that lower face height, okay, is much more than middle portion. So in case that you have increased amount of lower face height, you will have a vertical maxillary axis or incisal torquing. Okay. In case you have normal proportions, then the cause will be short upper lip. كمان مرة، إذا إحنا قسنا المسافة at rest lock position وكانت أكثر من 3 ل 4 وطلبنا من البيشنت يعمل emotional smile وبالايموشنال سمايل صار عندنا gummy smile، then احنا الان دخلنا بثلاث اسباب المتبقيه اللي هي either بالسلايد اللي قبلي either short upper lip, over eruption of maxillary incisor or vertical maxillary axis. طيب اي واحد فيهم حنبتدئ فيه؟ نبدا في الفيرتيكال maxillary axis. We start with the vertical maxillary axis in which we will take a cephalometry and we will measure this amount. If it is increased, then mostly the cause is vertical maxillary axis or maybe sometimes torqued upper maxillary central incisors. If this proportion is equal to this one, if this height is equal to this height, then mostly the cause is the short upper lip. Okay. Now, again, when we take the cephalometry, we take the distance from the nasion to the anterior nasal spine, and we measure it from the anterior nasal spine to the menton. This distance here is much more than this distance, and in these patients, mostly they will have vertical maxillary axis. Okay. بالشورت ابر ليب again حكينا كيف بتشخص هذول المرضى. بيكون الفلترم المسافه اللي هون قصيره والمسافه اللي هون جدا طويله. اتفقنا؟ ناو اوكي، انت حكيت انه لو زاد هذه المسافه حيكون vertical maxillary axis او torqued anterior incisors، وناقشنا قبل عده سلايدات انه انت لو شفت اللاين اللي هو connecting الاوكلوجن هون، الاوكلوجال تيبل is straight, okay, and then only the central incisors are over erupted and lingually tipped, the cause will be this one, okay. But اول شيء بتروح له انك بتقيس بالسيفالومتري وبتعرف انه اذا كانت هاي زياده معناته على الاغلب حيكون يا اما vertical maxillary axis او torqued upper anterior incisor, okay. The second point is if this portion is equal to this portion, mostly the cause will be short upper lip. Okay. طيب. We already talked about this one. Now this table will discuss it all. You can take a photo for this one. Someone is asking why we are taking X-ray and expose patient to radiation. Mostly those patients, before you, we need to take a cephalometry to have a complete diagnosis for them, and before referring them to our orthodontist, yes, we need to take a cephalometry. And I think nowadays, with the use of digital X-ray machines, the amount of radiation is much less than what you are thinking about. Okay. You can measure this one clinically. Someone is asking, can I do it clinically? Yes, you can, but to have a confirmative diagnosis, sorry. If you want to have a confirmative diagnosis, you have to measure it on the X-ray, because you need to, if you remember, everybody, when we were at dental school, we just make points on this X-ray. We just mark the nasion and then we'll mark the anterior nasal spine, and we mark the mental, and then we start measuring it exactly. We cannot give a definite diagnosis of the increased lower facial height without doing this, okay? Now, again, I will just revise it very fast, okay? As we said before, that the earlier diagnosis of gummy smile was low or average or high lip or high smile line, according to the posed smile, in which we said that if there is more than 2 to 4 millimeter of gum is shown, then this is a case of gummy smile. But now I'm discussing about 5 reasons of that, depending on a resting lip position, and then asking the patient to do emotional smile. If we started with 3 to 4 millimeter wrist lip position, and then ask the patient to do emotional smile, then we will have 2 main reasons. If he has a gummy smile, we'll have 2 main reasons: altered passive eruption and hypermobility of upper lip. In case you ask your patient to give you a wrist lip position and he give you more than 3 to 4 millimeter, and after that ask him to do an emotional smile and he show you a gummy smile, then the other main reason, which is vertical maxillary excess and over eruption of maxillary central incisor and short upper lip. Now, do we have combination? I like the question. Do we have a combination of these 5? Of course, but you have to know what to start with. What does that mean? If you have a patient that is having maybe at wrist lip position, he has more than 3 to 4 millimeters shown, okay, and you ask him to do a gummy smile, and then he will give you a vertical maxillary excess cause. At the same time, clinically also you diagnose that he has over eruption of maxillary central incisor. This is a combined cause sometimes, and it can be combined also with short upper lip. And at the same time, if you patient came to you with a wrist lip position, amount of central incisor shown at wrist lip position is 3 to 4, which is normal, and then you ask him to do a smile, emotional one, and he give you a gummy smile, if you diagnose that it's an altered passive eruption, okay, and at the same time you correct that altered passive eruption and still the patient is having gummy smile, then it can be another cause. So what to do in these cases? I feel it's not fair to refer the patient, and I will discuss the treatment right now. It's not fair to refer the patient to a maxillofacial surgeon to correct the vertical maxillary excess or to an orthodontist without giving him teeth with normal proportion. As a general dentist, I said that out of those 5, you have to correct the proportion of the teeth. Once you correct the proportion of the teeth, either by laser or crown entering surgery, you will refer your patient to the appropriate specialist or consultant and not causing him excess harm. How is that? Let's say that you diagnose your case with vertical maxillary excess and you want to refer your patient who has also short crowns. Without referring your patient and correcting the gum before referring patient to the surgeon will cut more from the maxilla to correct that one in orthodontic surgery. So you might have combined causes. You might have all of these causes combined to each other. But first, you have to correct first. I mean, correct the altered passive eruption first, and then try which is the next cause for that. If you can correct, do that. If not, then refer to the appropriate specialist or consultant, okay? And I will show you one of the cases in which I have different causes, but I tried it, I go with it step by step. I approach it step by step in order to correct it. So what are the treatment methods for the gummy smile? As we said, we need to differentiate between different causes of the gummy smile and then start to determine exactly what was the initial cause, what was the other causes for that, okay? And then go to treatment step by step. Now, as I said that most of the patients who has vertical maxillary excess or torqued upper anteriors, those patients are young. And it's a great opportunity for us and for the parents to start treating this patient from beginning so that we will just save the patient from further maybe advanced procedures. like in those patients, the young patients, if in case that you diagnosed him with the vertical maxillary excess and incompetent lip, and then he has a gummy smile, you should refer him to the orthodontist in order to do for him the appropriate appliance to correct that and to do the needed to correct the vertical maxillary excess and the growth, and at the same time controlling this problem while the patient is still growing. What happened is that most of the patients who came to you are either adults or let's say 20s, okay? You rarely see parents who are concerned about a gummy smile in their kids. And the gummy smile, because they said they are still growing, you still have teeth erupting, don't worry about that. But the main problem was not diagnosed because they are not aware of those causes in which the vertical maxillary excess increase is a main cause of their gummy smile, which cannot be corrected while they are growing, maybe sometimes, and has to be diagnosed by the appropriate specialist and try to treat it. So my point of view is that in case you, in case any patients, young patients came to you with the cause of gummy smile is vertical maxillary excess or torqued upper anteriors, you have to refer him early to the appropriate orthodontist, okay? I have a question. Is the gummy smile related to class 2 malocclusion? Yes, because class 2 malocclusion, most of the patients, they have it retruded upper anteriors. It might sometimes be the cause. If it is the, after you make the rest lip position and then ask the patient to do the emotional smile, again, follow the steps and then you will know. So what we will do in cases of upper anteriors, we will refer to the orthodontist to do mini implants. We will refer the patient to, okay. So we will refer the patient to, okay. We will refer the patient to the orthodontist, and they can fix either the vertical maxillary excess or anterior dentoalveolar complex by doing mini implants and try to intrude these upper anteriors and correct the problem. So if the cause is vertical maxillary excess, again, we will, if the orthodontist cannot do anything because the patient already if the patient was diagnosed with vertical maxillary excess and the orthodontist, and he's not a young patient anymore, the orthodontist can do nothing in these cases, you should really help your patient by altering or changing and getting his teeth back again to the normal proportion. I mean, before referring your patient to the orthodontic surgeon to correct the vertical maxillary excess, you need first to check his tooth proportion. This will save the patient cutting part of the maxilla in orthodontic surgery. I mean, if the patient has like short clinically crown, and if you do for him the crown lengthening before referring him to the orthodontic surgeon, the orthodontic surgeon will take a decision to cut less of upper maxilla in order to correct this this vertical maxillary excess. يعني إذا أنت عندك مريض شخصته إنه هو vertical maxillary excess، إذا كان طفل أو صغير بالعمر, and we can modify his growth maybe and help him to do by doing orthodontic treatment and help him to minimize this problem, he is lucky. If not, بعمر الأكبر من 14 15 وأطلع أكثر من هيك, you need to refer him maybe to the orthodontic surgeon. In those cases, please try your best to make sure that the proportion of the teeth is right. يعني انك تفحص الطول على العرض على الطول وتشوف before انك تحوله للاخصائي. ليش عم نعمل هيك؟ لانه في هاي الحالات انت بتوفر على المريض شويه انه الاخصائي السيرجن انه يقص اكثر من العظم او الماكسيلا, so that he will save you more bone. At the same time, maybe after he finish, the patient will come back to you and will ask you to do the crown lengthening. At this time, you will cut, but now most of the tooth is covered by the lip. خلينا نتخيلها مع بعض. إذا أنت الماكسيلا الجراح رفعها لفوق, أوكي؟ اللي بيحصل إنه إذا المريض رجع لك وcorrected the gummy smile, but he's asking you to make the gum line correct by laser or surgery, then still the crown is under the lip because the surgeon cut much more from the maxilla right now. اوكي. نروح طبعا زي ما حكينا احنا شخصناه اوريدي كيف هو عنده فيرتيكال ماكسيلر اكسس، والحل بيكون عن طريق شيء اسمه ليفورت 1 osteotomy. So those patient will be referred to the orthodontic surgeon and he will do a Lefort 1 osteotomy in which we will cut part of the maxilla from top, and then we will cut the part of the maxilla, we'll push the maxilla up, and by doing this we will try to minimize the gummy smile. اوكي. الالتر باسيف ايربشن زي ما حكينا واحد من الاسباب انه احنا لو اجانا المريض على الريست ليب بوزيشن كان 3 to 4 ملم and then we ask him to do an emotional smile and then he show us a gummy smile, the first option is maybe we need to check the alter passive eruption, and this is the maybe the only thing that we can do in the clinic before start referring to other dentists. يعني you should measure the proportions and cut whatever it needed. We'll talk about this later by laser, by surgery, and then by either even different kind of surgeries. And this is the only way to do that. المرضى هذول احنا يعني من حظنا انه هم بيكونوا متوفرين بكثره احيانا في العيادات. They are available and they are a lot. And you should correct, as a dentist, you should correct this proportion before start referring or talking about orthodontic treatment, orthodontic surgery, or maybe Botox and filler, as we will say, Botox treatment, we will already discuss. But first, correct the proportion. What if the cause was hypermobility of upper lip? Two types of treatment we can do on those patients. Okay. First kind of treatment we can do surgical lip repositioning. I will talk about it later. And Botox injection. شو هدفنا من علاج الهايبر موبيليتي of upper lip؟ إنه to minimize the upper lip pull while the patient is smiling. And we can do that, as everybody know, by injecting those 2 points with Botox injection here. Later, Dr. Haider, inshallah, maybe at the end of coming week, he will talk about this in one of our lectures. So injecting a Botox injection here and there, and some of the patients sometimes on a lower point, we will minimize the movement of these upper muscles, and patient will have maybe sometimes solving his gummy smile problem. The only problem with Botox is that it's relapsing. So every 6 to 9 months, you need to, the patient need to come back again and do the Botox again. What about the other option that we have? The other option is lip repositioning technique. And in those patients, once you diagnose that the cause of the gummy smile was hypermobility of upper lip, you can give him this option only if you correct the proportion here. Yani, first, you need to correct the proportion here, and then discuss with him this kind of surgery. Now, what is this surgery? And it's a different technique. Usually, I do it in my clinic, and I just try to convince my patients that this kind of procedure is a little bit more advanced, and at the same time, it is relapsing also. And why it's relapsing, I will talk about it. In 2007, Simon just discussed this procedure, and he said that we can cut the muscle insertion of the elevators muscle responsible for the gummy smile by cutting the amount of mucosa here in a special way. What is this way? Usually, it needs a full lecture for that, but usually we need to follow the mucogingival line here, okay, which is the line that separates the attached gingiva from the alveolar mucosa, and then we extend it to the level of our gummy smile into both sides, and then try to measure exactly how much we want to minimize the gummy smile. Okay. And then try to do some kind of procedure called split thickness technique, in which we try to split all of this amount of mucosa and then trying to suture this line again to this line. So what we do is that we try to split thickness and split thickness procedure, in which we separate only the alveolar mucosa and muscle insertion from that side, okay? And we go from this side to this side. This amount of gum is all cut, this amount of mucosa is all being cut, and then we suture back everything to its place. little bit tricky and demanding procedure. In this kind of procedure, you have to make sure that you are really have enough skill to do it. At the same time, you have to be symmetrical in your suturing even. You have to suture first the middle line and then start suturing the one side and then start suturing the other side. Not easy at all. Most of the patient, they will have a scar, but it will be hidden under his lip. Promising good results, but it's relapsing. Within less than a year, you will have your patient again having gummy smile back again. My approach is I will do this kind of procedure. At the same time, I'm gonna give him Botox injection. My plan is to just relax the muscle in healing time, because why the relapse happened? Because while the healing time is going on, the patient keeps smiling, moving, and everything. So the muscle go back again to its normal situation and insertions. When you give your patients at the same time of this procedure a Botox injection, what happens is that the muscles will be more relaxed, and then it will even take time to relapse again, and you can extend it up to maybe sometimes 18 months. Okay. Okay. We already discussed that. Okay. Yes. In those kind of procedure, I mix between two. I do surgical lip repositioning and Botox injection. In cases of hypermobility of upper lip, I advise my patient that Botox alone will relapse, surgical lip repositioning will relapse, but if you combine both together, you will have extend the time that the gummy smile will go back again. So in case of each procedure alone will take like maybe sometimes 9 to 12 months. In case you use both together, it might maybe stay up to 18 months in most of the patient. Okay. So your approach in the Botox will be discussed with Dr. Haider at the end of this week. If you didn't register for this webinar, please do. In those kind of patients, you can do it as a dentist if it's allowed in your country, or you just refer it to your dermatologist. We just inject a small portion of petroleum toxin on this side and on this side here, and then we'll try again to, if it is a severe case, we'll inject in a lower point sometimes. Again, depending on the severity of the case, it is relapsing. Okay. Now this is the case, and I will be ending my webinar with it. And this is one of the interesting cases that I had, and maybe a mix of almost 2 or 3 causes together. Okay. Yes, it is relapsing. If we start both procedure, yes, it will relapse, but it will be extended more. Okay. Now, in this patient, she came to me. Actually, she is a wife of my one of my friends, and she asked to fix her teeth. And usually, I'm not rushing. Most of my patients, I don't rush into cutting the gums without little bit diagnosis, maybe more the factors that we had this situation. If you notice in this patient that when she smiles, she has asymmetrical gummy smile. You can see that starting from this point, you will start having a little bit of smile shown, and then from the mid of left central incisors going back, you will have the gummy smile on one side more than the other side. And in these patients, usually they came and they heard about laser surgery or laser treatments, or sometimes the surgical crown lengthening. But you will say in your mind that, okay, let's go step by step. You can notice that this patient is giving me a paused smile, yeah, and in the paused smile, sorry, in the wrist lip position, I don't have the photo. In the wrist lip position, she only showed me 3 to 4 millimeters. Now, this is the paused smile or little bit emotional smile. And then on this emotional smile, she's giving me this kind of gummy smile. First point I should look at is how much amount of gingiva is shown. But another point which was really interesting is that it's asymmetrical. And the cause of asymmetry was 2 factors. First factor was that the maxilla is little bit canted. Okay, you can notice that in her, when you look at her face, that the left side is little bit canted, okay? So the level of maxilla is little bit canted, moved, yani not parallel to the level of the pupil. So the maxilla is little bit canted. This is one of the main causes, okay? And this is caused asymmetry for me. Now, this is not a cause of gummy smile, it's a causing of an asymmetrical gummy smile, okay? But what was the main reason for gummy smile? Because when I measure the teeth here, almost I'm into golden proportion, almost I'm there. In centrals, I feel that they are fine, okay? And in laterals, little bit need to be elongated, okay? In canine here, it's already not a gummy smile condition, while in this canine, it's a little bit short. So my approach was, okay, let's first go, as we discussed, let's correct first the altered passive eruption happening here, in which that part of the gum is covering the teeth. So when I did that, I ended up by having this, okay? This is a surgical crown lengthening, not laser crown lengthening. I ended up by having this. But if you noticed, I did another thing. I tried to correct the canting that happened in the maxilla by, yes, it's just 1 second, everyone. I think I'm going live again. Just 1 second, everyone. I think I'm going live again. Okay. So let's continue. In this case, after I okay. So let's continue. Okay, so let's go back again. In this case, I try to correct the occlusal plane, okay, by adding some composites on the part of the teeth and trimming from the incisal edge of other teeth. So I tried my best visually to correct the level of the upper maxilla. But still the patient is complaining about the level of upper lip here. As you can see, the gummy smile still on the left side is not as the right side, okay? So what I should do now, how we treat the hypermobility of upper lip. First, we correct the proportion, okay? But we need to correct also the hypermobility of upper lip. So I proposed for the patient the Botox injection, and she agreed on that. And after the Botox injection, after the Botox injection, we reached to this result. So in this case, the approach was little bit step by step, in which we try our best to correct first come first, which means that we correct first the altered passive eruption by correcting the proportion of teeth, try to correct the canting from top so that we can add some composite here, trim from the incisal edge from other teeth until we reach to a level that to the eye, it's more relaxing that the maxilla is not canted, okay? In this case, I made osseous surgery. I will come to this topic later, inshallah, in another webinar. We will discuss the technique of doing the crown lengthening surgery itself. But in this case also I did do also some composite fillings on the lower anteriors and also adjusting the incisal edge on the other side. And then I use the Botox injection to level the muscles on the right and left. So the interesting part is that, and I missed it, okay, I missed that, the diagnosis, by the way, why we do have canting in one side more than the other side. And actually, if you count the teeth here, you will see that the patient has done orthodontic treatment. And in this orthodontic treatment, she extracts one premolar here, while the other premolar is there. And I believe that in orthodontic extraction, most of the time, if the patient did orthodontic extraction and it was not, I mean, even on or symmetrical on both sides, this will end up by having some canting in the upper maxilla. And this will start also alarming me and most of the patients that did extraction during orthodontic treatment, that in those patients, sometimes if the treatment was done not properly done, it will end up by having canting in the maxilla. So just to revise you again, to revise the topic again, we need to have a different way of thinking about the gummy smile. لازم نحاول to approach الكيس in a different way. Usually اللي أنا درسته وأنتم كلكم درستوه إنه إحنا we have to classify the gummy smile according to the level of gum shown during post smile اللي هو اللو الافريج الهاي. بس اللي أنا حاب اليوم إني يعني نحكي فيه أكثر أو اللي ناقشناه إنه how to diagnose the gummy smile from a rest position and then asking the patient to give me emotional smile. A very good point انك تفرق بين البوزد سمايل اللي هي asking the patient to smile while photos. هاي الابتسامه بيقدر المريض يعطيك اياها 100 مره نفس الشيء. اذا طلبت من المريض يضحك او حكيت له نكته وضحك وحاول يخبي اسنانه، هاي هي الايموشنال سمايل. احنا our mission is to control emotional smile as much as we can. Why is that؟ لأنه patients can control their post smile ومتحكم في نفسه إنه يأخذ دائما نفس الصور، أو إذا أنت سألته يتصوره حيعطيك دائما نفس الصورة. اللي إحنا بنحاول إن نعالجه بهذا النوع من التشخيص هو تشخيص الإيموشنال سمايل أكثر. أوكي؟ بهاي الحالات أنا بطلب من المريض إنه يكون بريستليب بوزيشن. وشخصنا 5 اسباب للجامي سمايل. بطلب منه يكون اول شيء بريستليب بوزيشن ويعطيني 3 واقيس المسافه اللي انا اي كان سي السنترال upper central incisors. I will ask him to wet his lip and then measure the amount of central incisors shown. Then I will ask him to smile. Now you will have two kind of patient. البيشنت اللي بدأت فيه بالبداية كان 3 to 4 mm amount of central incisors shown at rest lip position، وبيشنت نوع ثاني كان at rest lip position كان أكثر من 3 to 4 mm. Now you ask both patients to smile. The first patient which is having 3 to 4 mm, if he give you gummy smile, then you will have two causes of gummy smile. Altered passive eruption اللي حكينا إنه الجم بتكون عاملة over growth over the anterior teeth لسبب انه ما صار في عندنا الباسيف ايربشن، والسبب الثاني اللي هو الهايبر موبيليتي اوف ابر ليب. طيب خلصنا من مجموع 5-2. المريض النوع الثاني اللي هو كان ات ليب بوزيشن كان عنده اكثر من 3 to 4 ملم. بعدين طلبت منه يعمل ايموشنال سمايل واعطاك جامي سمايل. هذا صار بيتناقش ب3 اسباب اخرى اللي هي الفيرتيكال ماكسيلاري اكسس اللي بيكون فيها الفيس هايت هون زياده، بنعرفه عن طريق الانكومبتنت ليب او عن طريق السيفالومتري، او تورك ابر ماكسيلاري انتيريور، هذا السبب الثاني، او بيكون عنده شورت ابر ليب اللي هي بيكون فيها المسافه بالنص هون الفلترم بتكون كثير اقل من الفلترم بيكون كثير اقل من الكوميشنز. اوكي، الابروتش كالتالي، انت دائما لازم تبدا ستيب باي ستيب، دونت تراي تو ابروتش all the causes together. اهم نقطه انت كدنتست كجنرال دنتست او كبريدونتست ايفن، انك انت تحاول قدر الامكان انك تصلح الجولدن بروبورشن اوف ذا تيث اللي هي الويدث اوفر ذا لينث. وانس انك صلحتها jump to the next cause. اوكي، اذا كان الكوز فيرتيكال ماكسيلاري اكسس هو البدايه انك تصلحه، او هو البدايه انك انت تشخصه، لانك اذا انت وجدت انه اللور فيس هايت نورمال مع الميدل فيس هايت، انت يو اكسكلودد الفيرتيكال ماكسيلاري اكسس. بس انت خطا انك تحول مريضك للاورثوغناستيك سيرجن وانت مش مصلح له البروبورشن اوف تيث. اوكي، من الجيد انك تشوف المرضى اليونج، الاطفال او اللي باعمار صغيره، اذا عنده فيرتيكال ماكسيلاري اكسس او تورت ابر ليب، انك تحاول تو ريفير ايرلي تو كوريكت ذيس بروبلم، وانك ما يكون يعني ما تضطر انك في المستقبل تحوله لماكسيلو فيشل سيرجن عشان يعمل له اورثوغناستيك سيرجري. البوتوكس واحد من الحلول، لكن لازم يكون السبب هو هايبر موبيليتي اوف ابر ليب. كثير من الحالات اللي بشوفها عندي بالعياده عاملين بوتوكس بس السبب مش هايبر موبيليتي اوف ابر ليب، بيكون شورت كلينيكال كراون، والبلاستيك سيرجن او الديرماتولوجيست اقنعوا انه البوتوكس هو الحل لحالته. اللي بدي تفهموا انه البوتوكس مش حل لكل شيء، هو مساعد، هو فقط لما يكون عندنا هايبر موبيليتي اوف ابر ليب. حرام تظلم مريضك اللي عنده شورت كلينيكال كراون وانت لازم تصلح له اياه عن انك انت تحوله للبوتوكس and he will inject botox having okay maybe paralyzed the smile، بيكون شكلهم مثل المشلولين لكن الاسنان بتكون قصيره. ف try to انك ريفير الكيس من يعني واحد يعني ابتدي بالسبب الصحيح وبعدين روح للسبب الثاني. مش من العدل انك انت تحول مريض لليب ريبوزيشننج او لبوتوكس انجكشن اذا ما عنده هايبر موبيليتي اوف upper lip. It's not fair. It's not fair to refer a patient to an orthodontic surgeon to do vertical maxillary excess surgery, but you still didn't correct for the surgeon the proportion. In this case, he will try to cut more from the maxilla to hide the gummy smile. In case of short upper lip, guys, the treatment is to refer to the plastic surgeon. They have some kind of procedure to elongate the upper lip. We can do nothing as dentist for this one. Okay. For the end of my lecture is that I really wish that I just decrease the level of confusion in the treatment of gummy smile. Most of the cases, guys, when we start this topic, I think that the level of confusion was a little bit high, and I really hope that by the end of this lecture that still, if anybody has still confusion, to ask me, but we need to go step by step in treatment of gummy smile. We shouldn't jump into botox. We shouldn't jump into laser machine and cut tissues that shouldn't be cut. There are mainly 5 causes. Other are small, or let's say not contributory factors. We should mainly treat the main factor before jumping to the next one. From my point of view, there are abuse of the treatment of botox and filler, and abuse of our patient by doing lip repositioning surgeries. Sometimes even most of the patients, they really don't appreciate referring to a maxillofacial surgeon without doing anything. And I can show you some of the cases in which that my patients really like the treatment of the crown lengthening, and then they don't like to be referred to a vertical to an orthodontic surgeon. I mean, معظم مرضاي احيانا بكون حكي له انه اوكي اول شيء بدنا نعمل لك الكراون lengthening surgery and then we might refer you to the surgeon to do the orthodontic surgery. And 60, 70, 80% of them, once I correct the gummy smile with the crown lengthening, he will be maybe happy with that. Even patients sometimes before referring to Botox, when I do my crown lengthening surgery and then try to refer him to the Botox, he said, no, now I'm really relaxed with the results. No need to go to the dermatologist. One of the questions here I've been asked is that, do you inject on one side of Botox more than the other? Actually, we inject both sides the same amount, and then on the retouch visit, we measure how much exactly this side is more than the other side. So when you have uneven level of lip, we inject the same amount, and then we inject on the retouch visit the other side, which is not fully relaxed. Okay. At the end, please, I would like to help all of you, to thank all of you for attending this lecture. I wish I explained the topic the way that you liked. It's not easy for me to discuss. Sometimes I need to have my tools and maybe some other explanatory instruments to exactly help me to discuss the topic well with you. Wish you all the best, and please register for the coming webinars. We will start again back on Monday until Friday. Very interesting topics: prosthodontic, veneers, Botox and filler, endodontic with Dr. Hammo, how to manage the crisis that we have right now. Please stay safe, stay healthy, stay at home, and together, inshallah, we will pass through this time. Wish you all the best and see you very soon. Thank you.